Hey, how's it going, everybody? This is Ryan Bristol, physical therapist. How are you all doing? I hope you all had a great Thanksgiving weekend and had some nice time to just relax and enjoy with your family and friends, and having a safe holiday season. Um, a couple weeks ago, I asked if anybody had any questions or wanted to hear some new topics about low back pain and sciatica, and I got a really nice question or request from one of our members saying that her question was, what exactly is it that I do? What recommendations do I make for someone with advanced lumbar spondylosis and lumbar radiculopathy? What is my approach? How is my approach different from other physical therapists? And other questions like what exercises would I recommend for certain conditions of lumbar spondylosis and radiculopathy? And what are some other questions? And basically how far can my approach really help people even when they have advanced conditions and have likely tried PT and all sorts of other types of healthcare disciplines like massage and maybe even chiropractic, and still end up struggling with pain. So where does the cutoff, I guess you could say, where's the limit on how far this can take everybody? So I thought that was a great question, and I want to do my best to answer all those questions for you. So my approach, I call it the 5-step approach. And this 5-step approach, it's designed to help really any case of low back pain, whether your pain in sciatica is coming from a bulging disc, herniated disc, arthritis, spondylosis, whether it's mild or severe, degenerative disc disease, spinal stenosis, scoliosis, just localized low back pain, or even radiating pain, full-on sciatica shooting down your leg with tingling and numbness. So this approach, even though it's going to be different from one patient to the next, everybody that I work with, all my patients, follow the same 5-step approach. And I like this 5-step approach because it keeps things very organized and it keeps things very consistent. And from what I've seen over the years, it's just led to results every single time. It's nearly impossible to not get results, and I will cover what those 5 steps are. But like I mentioned, what each individual patient will do will be definitely be quite different from one person to the next, because everyone is very different. Someone with pain and sciatica from a bulging disc might need something completely the opposite from advanced spondylosis or spinal stenosis. So it depends on what structurally is going on in their spine. But what I like to do is just kind of dive in and talk a little bit about what exactly those 5 steps are that all of my patients must go through when they work with me to get over ongoing low back pain, whether it's acute, meaning it's only been going on for a couple of months, or it's chronic, like it's been going on for several months or even several years, low back pain and or sciatica. So anyways, step one is the initial consultation, or you can call it the assessment or evaluation. All that means is myself and the patient, we have a sit-down conversation where we get very clear on exactly what is going on with this person's spine, what's causing their pain. And this conversation takes on average 30 minutes to an hour, and we just cover everything from where's your pain, how long has it been going on, what have you been diagnosed with by your doctor, what findings did you have on an x-ray or an MRI. One of my favorite, most important questions probably is what makes your pain worse. So what specifically makes your pain worse on a daily, regular basis? And some people might say, if I sit too long, my pain for sure gets worse after an X amount of minutes. And then getting from sitting to a standing position really is painful. Or walking a certain distance is very painful. Or putting on my shoes and socks is very painful. So things like that. Things are very consistent, and it just happens day in and day out. And then so that's what makes your pain worse. The next question is, what makes your pain better? So some people might say, if I go for a little walk, I feel better. Or if I if I lay down in a certain position, that makes me feel better. Things like that, or certain therapies or stretches that I've learned over the months or years makes it a little better. So that is I think is one of the most important questions: what makes the pain worse, or what makes the pain better? And we just have a very thorough conversation, like I said, over the 30 minutes to an hour, and that gives me a very good idea, or much more clarity on how to transition over to step 2. So that is step 1, and we don't move on to step 2 until step 1 is complete. So now we both have a lot of clarity on what's been going on with this patient. So the next step is to take all this into action. What we learned from step 1, we take it over to step 2. Now step 2, I do this with every single patient, doesn't matter what is causing your pain. Step 2 is the directional preference stretching approach. Now, some of you, maybe a lot of you, have heard about the Mckenzie Method. I'm a big fan and believer of the Mckenzie Method. It's a great approach, and it's a great way to learn how to reduce pain quickly. So in a nutshell, the Mckenzie Method it teaches you how to get on a directional preference stretching routine. So, for example, if someone has, let's say that you think the main cause of their pain is from a bulging disc. In theory, based on the Mckenzie Method, they might benefit from an extension approach, which is a lot of backward bending. So if I think that a patient would really benefit from that approach, I will organize those exercises for them, teach them how to do it and how often to do it, etc. And they will implement that over the next several days. And step 2, in my opinion, arguably could be one of the most important steps out of the 5 steps, because this is what's going to be your go-to for a very long time, maybe even permanently, on reducing your pain incredibly fast anytime you have a flare-up. So going back to the bulging disc example, but this might be very different from other people, like the spondylosis or arthritic people. But just for example, some of these patients will do a lot of backward bending, and some people will find very quickly whether this is helping them or not. Some people will find out in a matter of hours if it's helping them or not, and some people it might take 2 or even 3 weeks at sometimes. But the nice thing about this second step is it keeps things very organized, because we work on one thing and one thing only, is a single directional preference stretch, and then the patient is just doing that one directional stretch. Let's say that backward bending, and we're going to know if it's helping or not, because they're only doing one thing. And if it's helping, great, we know why it's helping. If it's not helping, then we can move on to something else. But that is step 2. Okay, so directional preference stretching, and kind of like going from step 1 to step 2. No one moves on to the next step without completing the prior step. So if someone hasn't achieved step 2 yet, we haven't figured out your directional preference stretch, we're going to stay at step 2 until it's absolutely figured out. We can't rush this. That's where things get really mixed up and very confused and unorganized. Okay, so patient completes step 2. We know what their directional preference stretch is. Then I progress them over into step 3, which is global mobility, global stretching. So let's just say backward bending and extension really help them. They stick with that, but now we need to move on to other things. They can't just do backward bending for the rest of their life. So now we target all the main important muscle groups, so they can't. So eventually they need to bend. They can't just do backward bending forever. They need to forward bend, so that way they can put on their shoes and bend over to pick up stuff when they drop their car keys on the floor. So now they need to progress eventually on an approach on how to ease themselves into forward bending. So they start working on flexion type stretches. So they'll work on stretching the gluteals, knee to chest type stretches, hamstring mobility, even ankle mobility for some people. Global stretching, so their hips, knees, ankles, the lumbar spine, maybe even the thoracic spine in some cases. But basically it's global mobility progressively. You can't just do it all right off the bat. If you do too much in step 3, it can really flare up someone's sciatica and set them all the way back to step 2 again if you progress things too quickly, and without the right, again, progressions and making sure that the patient achieves certain milestones along the way. You do too much all at once, you can set you right back, and again, you think you're at step 3, you got to go back to step 2 if it wasn't done properly. But let's say patient does very well with step 2, and now they've done very well with step 3. Okay, so now they've mastered directional preference stretching. They've mastered the global mobility to bend and rotate and move in all these different directions. Now they move on to step 4. Okay, so step 4 is intro to basic strength and conditioning. So introductory core stability, a little bit of strengthening for the core. So it's called lumbar stabilization, but it's strengthening. Definitely hip and lower extremity strengthening, like the hips, the quads, hamstrings, calf if needed. And again, you have to do things one step at a time, because if you go too crazy over at step 4, I've seen it, I've made these mistakes before. Do a little too much in a couple of days, again, flares up the patient, and gotta back off a little bit. So it's just a step-by-step approach, just like all the other steps. So step 4, we're just going to ease the person into some simple exercises that are essentially harmless, almost impossible to cause pain. Patient does well, start making it a little bit harder, and you just keep on progressing accordingly. And then patient achieves step 4, right? They've learned how to engage their muscles, they're building up strength, they're building up some endurance, they're learning how to do these things. We know over time it hasn't led to a flare-up, it hasn't set them back. Okay, so now we're really on track. Patient moves on to the next milestone called step 5. Now step 5 is a lot of fun because we can get very creative at step 5. It's really up to the individual, the patient, because everyone has different hobbies and goals. So step 5 is really return to prior recreational activities, prior level of function. So some people, that means they haven't golfed in a year. So we're gonna work on getting you back to golf. Some people like to do high intensity cardiovascular exercises like cardio kickboxing, cardio or boxing, tennis, hiking. You get very creative. There's really no limits to step 5, but there's no way we can just get into step 5 without doing the basics first. And just like all the other steps, step 5, we've got to start somewhere. You know, if you haven't done cardio kickboxing in the last, like 3 to 6 months, you probably don't want to go too crazy on the very first day of step 5. You want to, maybe break down your cardio kickboxing class into some of the simple activities, see how you feel, and build up accordingly. So those are, in a nutshell, my approach for every single patient. Doesn't matter what is causing your pain, that 5-step approach. And what's nice about it is it doesn't matter if you have advanced lumbar spondylosis, advanced stenosis, a bulging disc that you're diagnosed with. It doesn't matter, because patients will follow this routine, and you're only going to be getting better, because you're not going to go from step 2 to step 3 without making some progress. So it's nearly, I don't want to say impossible, but people will be able to find a way to move from one step to the next. And once you do, it's essentially impossible to not have some result. I can't necessarily say that you're going to be 100% pain-free, that you're cured, that your herniated disc is gone, your arthritis is gone. That is not the case. This is not a quick fix, and these patients have to work really hard along their journey. But a lot of people are motivated to get better, and that's what gets them to what their overall goal is. It gets them to their dream. It gets them to not only just reducing their pain, but they're back on the golf course. They're back running around with their kids and grandkids, having a great time, living their life really without having these blocks along the way. And it's a routine that they're going to be able to do for the rest of their life. This isn't a short-term quick fix like pop this pill, stick this needle in my back, and you're going to feel maybe good for a day or a few weeks, this routine is something you're going to be able to carry on and do for the rest of your life. So if 5 years from now you end up with back pain and a flare-up, guess what? You know what to do. You go back to step 2 and then work your way back up to step 3, 4, and 5. So this is a routine it's going to last you for forever, and that's why I find it's important. No quick fixes. I think Band-Aids are a bunch of waste of time. I don't like talking about ointments and kinesio tape and crap like that. If you like it, then fine, but I think you all know that those are all just supplemental at the most. To answer that other question though, where do you have to draw the line where a patient is just not a candidate for this? That's a tough question, but I would have to say in the medical field, it comes down to whether your condition is time sensitive or not. So time sensitive means that your condition is so bad. Let's say you have a bad pinched nerve and it's hitting on your spinal cord or the surrounding nerve roots, and now you've lost control of your bowel and bladder. You were walking one day and the next day you all of a sudden have a drop foot. That means you lost muscular function in an incredibly fast amount of time. Those things can be considered time sensitive, meaning that the doctors are telling you, like, hey, you need to get surgery like now. Stat. It's not common because most doctors, they really don't try to rush into this kind of spinal surgery because it's not just an easy thing. So if you have a time sensitive condition, like there's just you got to get into surgery now, this program is not going to be for you. But if your condition is not time sensitive and you have doctors telling you like, hey, we really don't want to do surgery, we really don't want to do any more injections, let's do our best on getting a conservative approach to this. Get on the right routine with the physical therapy or work with somebody, whether it's getting to the gym, start exercising, whatever the case is. That means you are not in a time sensitive case. It's not time sensitive. They want you to do everything you can to avoid surgery and to avoid invasive treatment options. So if that's you, then this approach most likely is good for you. Because it's safe, it doesn't make people worse. There's really no contraindication